The following segment is sponsored by Intermountain Health. The holiday season is here and parents are trying to figure out what toys will wow their kids but also keep them safe. Kelsea Peterson is a pediatric trauma surgeon physician assistant at Intermountain Primary Children's Hospital. She is here to share how we can keep our kids safe from dangerous toys this holiday season. Welcome to the show, Kelsea.
Thank you.
Well, this is a very hot topic because as parents are trying to pick out their toys, they want to keep their children safe. So talk to me a little bit about what are some of the injuries that you've seen with toys?
There's a lot of things that we've seen, but something that we worry about the most is when particularly small kids swallow things like magnets or button batteries.
Okay, so what other small toys and items can be a choking hazard? Like I was just talking to a mother the other day about marbles, right? The 5-year-old can play, but the 18-month cannot.
Yeah, I mean, almost anything can be a choking hazard. Whatever they put in their mouth is probably not supposed to be in there. So there's a lot of things that we do worry about. The ones that can turn into emergencies really fast, though, are specifically button batteries if those are swallowed, and then magnets can turn into emergencies as well. It just may take a little more time for those signs to show.
See, and as a parent, I've always heard about the button batteries. Watch out for those, but I'm not exactly sure why is that so dangerous? Like, what kind of injuries does that cause?
So when someone swallows a button battery, especially small children with just their smaller throat, when it starts to go down, it can get stuck. And the danger with a button battery is that when it gets stuck between the two sides of the throat, it almost creates a current, and so it's burning while it's in there. So every minute that it's in there is causing more and more injury, and that's why it's so important to get your child to an emergency room as fast as you can if you suspect that.
Okay, that was my next question, follow-up question on that. What would you do in that moment if they swallow it, knowing what you just told me? What do they do while they're waiting for the paramedics?
So if they are over 12 months, we always suggest giving some honey, because honey can help to coat the throat and sometimes slow down the rate of injury at least. If they're under 12 months, there's really not much you can do aside from moving as quick as you can.
Okay.
But if you suspect any kind of ingestion, we obviously recommend either going to your local emergency department, calling 911, whatever is faster. Specifically a button battery, we ask you to move even quicker if you can.
Okay, I hope you guys are taking notes on that. The honey is such a great tip.
Yep.
Okay, so what obviously timing is super critical when dealing with these injuries. What else can you do in the meantime? Once you get to the hospital, what are you guys going to be doing?
So once they get to the hospital, if you suspect your child has swallowed something, they're almost immediately going to come in and get an x-ray, because first we want to see, can we see it? Do we know where it is? Because it does make a difference where it is in their body as well, to figure out where we go from there.
Okay, well, what should parents keep in mind when shopping for toys this holiday season?
When shopping for toys, I would completely avoid anything like magnets.
Yeah.
They have these magnets that are really fun to pull apart and put together. They're like little fidget toys, but these can pose a lot of risks and a lot of injuries, and these ones sometimes are scary because the injuries don't show up right away. So it's something that can take a while to show.
Okay, and then also this little thing, it came in a little package. Basically, there's a warning sign, so keep your eye out for warning signs on a lot of those labels. Where can everyone go for more information?
For more information, I would go to intermountainhealth.org, and they will have just some information about primary children's, information about our emergency department, other local emergency departments.
Well, thank you so much for coming in, Kelsea, and talking to us. Keep your kids safe, and thank you for all your tips.
Yes, of course.
Happy holidays.
You too.